pretty astonishing, the levels of success and healing that we've been able to achieve with the patients who we've been treating with this new service. Again, TMS, Transcranial Magnetic Stimulation, is a treatment for mental health disorders. We have a lot of patients that have been able to get completely off of medications through the use of TMS. TMS is one type of treatment option for patients, and it's the one that I feel at this point in time in my career as being in the field of mental health for about 30 years now, that is the most optimal treatment choice. Typically, you could say 30 to 40% of people who get started on a psychiatric medication like an antidepressant are going to get a positive benefit. We're seeing amazing success rates, amazing benefits for the patients who are electing to get the TMS treatment. Hey everyone, this is Dr. David Lopez, back with you again to talk a little bit more about TMS, or Transcranial Magnetic Stimulation. It's an exciting new service that we're offering at our practice, Psychiatry Networks. I've been doing TMS for about the last 18 months now, and been experiencing amazing success, been pretty astonishing, the levels of success and healing that we've been able to achieve with the patients who we've been treating with this new service. Again, TMS, Transcranial Magnetic Stimulation, is a treatment for mental health disorders. It's FDA approved for depression, OCD, anxiety. Some devices also are approved for smoking cessation, and it's pretty cool. And just to recap what TMS is, transcranial magnetic stimulation is different than using medications. It is non-invasive, so it's non-medication based, does not involve medications at all, does not involve surgery, does not involve ECT or electroconvulsive therapy. It's actually involving the use, TMS is involving the use of electromagnetic energy. Magnetic waves are used to reset the electrical activity of a person's brain, and in so doing, we're able to achieve positive results in terms of reducing depression, anxiety, PTSD, things that are known as mood disorders, as well as thought disorders. So when people are not able to think clearly, focus, or concentrate, maybe have really bad ADHD, we're seeing gains in these areas in treating people with ADHD, people with mild dementias, pseudodementias, mild cognitive impairments. We're seeing results in those areas. We're seeing results with substance use disorders, seeing positive results with neuropathic physical pain reduction through the use of TMS, or transcranial magnetic stimulation. So the last time that I was on, I was talking about some of the questions we've received from some of the viewers who have watched my videos over the last couple of months. And I just wanted to spend a little bit of time now to go over a few more of those questions, since I had the opportunity right now to do that. So I'm just going to look at some of these questions that have been provided to me and see if I can answer them. We were talking about TMS earlier, again, involving the use of magnetic fields, magnetic waves to reset the brain's baseline electrical activity and get it back to normal without medications. But some people do ask, are you able to take medications and get TMS? So can I continue TMS therapy with other medications or other therapies? And the answer is yes. We have a lot of patients that have been able to get completely off of medications through the use of TMS. We also have other patients that were unable really to tolerate medications because of bad side effects, and then they've received TMS and they've done very well and gotten better and then not needed medications anymore. Now, there's other patients that have been on medications come do the TMS. They're still on the medications, maybe albeit at lower doses or maybe at the same doses. Haven't had any patients that have gotten TMS where we've had to increase medications. The goal would be to get people off medications, but you can do TMS and be on medications at the same time. So that's not a deal breaker insofar as if you are on medications, can you do TMS? They're not mutually exclusive treatment modalities. And in fact, they might be complementary to each other in some situations. So, but ideally, it would be obviously better, I think, if you don't need medications to not take them, and if TMS can provide that opportunity, that's a goal that we would always want for our patients, not to have to take medications at all, and to be able to have a stable mood and a very clear mind on a day-to-day basis. So that is the answer to one of the many questions that we've received here. I'm going to look and see what other questions might be. How soon can you start TMS therapy after an initial psychiatric consultation? Well, if you have an initial psychiatric consultation and you do qualify for the TMS and you're interested in pursuing TMS therapy, as long as, the physical exam and the initial psychiatric consultation checks out, well, you can start it pretty much right away. There's not a long wait time in terms of it's just more of a scheduling thing, but there doesn't have to be any lag time. It's more at the patient's discretion. And again, I want to emphasize that we do the initial psychiatric consultation just like we would do initial for TMS, as we would do initial psychiatric consultation for any type of clinical presentation. TMS is one type of treatment option for patients, and it's the one that I feel at this point in time in my career as being in the field of mental health for about 30 years now, that is the most optimal treatment choice. I mean, there's other options, obviously, but I am coming online now to increase awareness of the great potential benefits of TMS, because, like I said, it's been just astonishing what I've been seeing since I've been doing the TMS therapy and providing the TMS therapy for patients. And it's very gratifying, actually, for me as a provider and my team, my treatment team. We feel really good about the help that we're providing patients and improving their quality of life. And so I think for us, the goal is to get the word out there now, because we're seeing such success, and also we're learning as we go along. We're trying to gather more knowledge, and that does lead into another question here about research. What do the clinical studies say about TMS success rates? Well, again, there's subjectivity. We do, as a treatment team and as a practice, try to provide, how would you stay on the cutting edge in terms of providing a treatment and what are the best practices at the moment in the field of psychiatry, mental health. We have a little purple binder here that we put articles that we find of interest in. And I can tell you there's a lot of literature here coming out with different studies on TMS. I have one here, treating post-traumatic stress disorder with neuromodulation therapy, otherwise known as TMS. Efficacy of TMS with attention deficit hyperactivity disorder, systematic review with meta-analysis. Here's another one, repetitive transcranial magnetic stimulation in patients with borderline personality disorder. Very interesting. It would be amazing if we're able to treat successfully personality disorders, because those traditionally have been very hard to treat with pharmacotherapy or medications. That often involves not only medications, but intensive different types of psychotherapies like DBT and CBT. But as you can see, people are already researching the potential implications and applications of TMS for personality disorders, which would be really cool. Here's another one talking about mild dementias or mild cognitive impairment, cognitive enhancement, and neurologic and psychotic disorder using TMS. So again, we're talking on one hand mood disorders, and on the other hand thought disorders. And so there is literature out there on both, which is really cool, and personality disorders as well. And there are also studies going on with substance use disorder. In terms of success rates, what I'm seeing is benefits pretty much across the board. Okay. So I want to say, like, every patient, and again, knock on wood, I mean, every patient that we've been treating has been seeing some kind of benefit from the TMS therapy they've been receiving. Now, can I say 100% success rate? I can't guarantee that. That's not anything that I could do in good conscience to a potential patient. There's always a chance that there could be a treatment failure or treatment ineffectiveness. I will say, though, I think that the success rates with TMS are much higher than the traditional success rates we get with medications or chemical intervention. Medications, shots, IV, where we're introducing a chemical substance into the body for the purposes of changing for mental health brain chemistry in a positive way. Typically, you could say 30 to 40% of people who get started on a psychiatric medication like an antidepressant are going to get a positive benefit. So that means that 60, 70% do not get a positive benefit, often the first time around when they're trying medications. Now, TMS, what we're seeing is that, I'm saying 6 to 7 out of 10 people are getting a benefit, 60 to 70, maybe even higher, a positive response rate. So everything's pretty much switched around. The success rates are more like in the 60 to 70% area for a benefit from TMS, as opposed to when people take medications, it's only 30 to 40%. So, and I would also say that the TMS is much safer because you're not introducing a chemical into the human body. What we're doing is basically we're resetting the electrical activity of the brain back to the way it was meant to function on a permanent basis. We'll get it back to the baseline. And then once that's done, people are, what we're seeing are often good to go. Whereas with medications, a lot of times when people start feeling good, they stop taking the medications, they backslide and they get worse again. So I feel that the success rates of the TMS thus far, what I'm seeing as a line clinician, a person that treats patients every single day, and our treatment team treating patients every single day, we're seeing amazing success rates, amazing benefits for the patients who are electing to get the TMS treatment, much more than people who are doing the traditional prescription medication route for the mental health issues. Also, I think that it's so new that a lot of people just aren't aware of the TMS, but if they, as a treatment option, if they elect to get the TMS, they're going to see really high rates of success and very positive benefits too. And so that answers that question. Let's see, safety of TMS. So I already mentioned that. Safety is, I think, better actually than traditional chemical solutions, which are medications, prescription medications, basically for psychiatry. And you're not putting a chemical into the body. You're non-invasive. There's no radiation, no surgery involved, no ECT, completely new treatment modality. So the difference again, TMS is non-invasive. Medications is chemical intervention. So by definition, it is invasive. You're putting a substance into your body. So that is the primary difference. That was another question, TMS versus medication. What's the difference? TMS is, medications is a chemical intervention. You're changing the chemistry of the brain with a chemical reaction. And then TMS is a electromagnetic intervention that is non-invasive in nature, and it approaches changing or helping heal the brain by resetting the electrical activity of the brain. So those are some more of the answers to the questions that we are receiving. I'm gonna continue to take time to review these questions, and if people have other questions, please send them to us. My practice, our organization's name is Psychiatry Networks. We're based in Northeast Ohio, our main office, but we work in multiple states actually. But our main office is in Cleveland, Ohio, Northeast Ohio, on the shores of Lake Erie. And you can reach us at www.psychiatrynetworks.com or 216-341-0070. And if you find this video interesting, please like it along the way and tell your friends and family about it, especially if they're dealing with any kind of mental health issues, substance use issues, mood disorders, thought disorders, physical pain, neuropathic pain, because I really believe TMS can be, it's not really even believing, I'm seeing it be a solution for all of the conditions that I just mentioned in a very robust and outstanding fashion for the patients that we're treating. So thanks for listening. I hope you all are having a good day wherever you are and whatever you're doing. And I'll look forward to coming back and talking with you again soon and answering more questions as well. Okay? Take care. It's Dr. Lopez signing off. See you later. Bye-bye.